You are listening to the Namibian's audio recording.
Just in short, please explain to us what is happening to you.
Okay, for now I'm doing fine, but I'm currently now on this department of COVID-19. I'm a patient of COVID-19 that is positive. And I was admitted on the hospital, this department of Ponja, on the 29th of June. But the day I was admitted in the hospital. I'm pregnant with 7 months. On the 8th of July, I experienced not to feel my baby's movement. I informed the nurse that were on duties, and no one responded. They only told me that it's normal and maybe the baby's sleeping. Okay, on the 9th, I still inform a nurse. They are telling, no, we cannot do anything since we don't have a machine to check up on you, so you guys just try your best. We are still working out on this. On the 10th, it was the follow-up of my ANC that they're supposed to check on me. Morning time, I called a nurse to inform him about my follow-up, and then he said, no, I will come back to you. Later on, he did not show up. I called him again to confirm that I need attention for today, since Wednesday and Thursday I did not feel my baby's movement. I need attention for today for my follow-up. That day I was answered, there's no way we can do anything about this. So just try. We're also trying our best, asking these people from the Ministry of Health if they can provide us machines to come do the ANC for all of you pregnant women that are COVID-19 positive. Okay, I understand. The whole day goes off, no one attended. Saturday again, no one attended. I tried to call my father to inform him about this. He tried all his way best. On Sunday, there was a doctor that showed up to do a checkup. The nurse just was using a black pump to check the heartbeat rate. He left the thing and then he went out, and then I asked, oh doctor, can you just tell me what is next? He said, no, I'm coming back to you. And then I said, okay. He never come back. I tried to reach my father again. I did not get any help. The doctor was here. He did not respond. He did not tell me anything. And then my father tried his level best again to talk to another person, to get another doctor to come to me again. The doctor came and checked up on me again. The second doctor told me, no, the baby is fine. The baby is alive. So, you don't need to worry. So if you are having any headache, try to take 2 tablets of Panadol and then you drink. They said, no, it's fine, I don't have a headache. Okay. He went. And then I tried my father again. No, he will try to send refer another doctor, because they're supposed to come with the machine at least to check how is the baby doing inside. Later on, the other doctor came with a CTG machine now to check, but it was still the same thing. It's just to check the heartbeat rate of the baby. They used it, and then the doctor was struggling. It took almost 3-4 hours. And then I asked him, doctor, why is the CTG machine going off and going on? He told me, no, I'm struggling to find the heartbeat rate of the baby. Then later on is when he told me, no, can you hear the sound? And then I said, yes, I can hear the sound. Okay, that sound is for the heartbeat rate of the baby. And then I said, okay, can I just check on the screen to confirm if the heartbeat rate that is beating is my heartbeat of my fetus, or is it for myself? Okay, he said, no, just wait, I'm still busy. He finished, and then he took the machine, and then he went out. I asked him again, now what is next? I said, no, the heartbeat rate of the baby is fine. So tomorrow I will make sure I inform someone to attend you again for the checkup, because tomorrow I will not be on duty. And I said, okay, it's fine. But still, I was still doubting that day that how can the baby heartbeat rate is beating and there's no movement? I let it be. On Monday, I called my father, called me in the morning. Try to do some walk and sit down for 30 minutes on your bed, and then you will see if there's any movement. Because maybe it's just that you guys were always sleeping and you never go out to do some exercise. Maybe the baby's just laying on one side. I wake up in the morning on Monday to do a walk and come back in the room. I sit down for 30 minutes and then I wait. There's no change. And then I sleep. And then I call back my father. Said, no, there's no changes. Then my father asked, is there no nurse or doctor attended you yet? Then I said, no, there's no doctor, no nurse attended me. Okay, around 1, my father called again. Did someone come and do a checkup? Then I said, no, there's no one come and do a checkup. Okay, let me try my best. Around 2, a doctor that is dealing with all others, nurse and doctor among others, the one on top of others now. He the one came in the room, undressed, those are NIPS dressing codes that are protecting themselves. He did not wear those ones. He just come and open the door asking, who is who and who is who? And then my colleagues from the room said, no, it's that lady sleeping there. Okay, can you just listen to me and face to me and then I can talk to you? I turn my face and then I look at the doctor. I said, and then he asked me, why are you sending messages to people that people are not attending you? What is the problem? Then I said, no, doctor, I have a problem of my baby's movement that is not moving at all. Was there not someone yesterday here on Sunday doing a checkup? And then I said, doctor, there was, but all of them, they were saying they are struggling to get the heartbeat rate. It was very low. Then I said, so what are you expecting? Are you expecting them to make your baby move or what? And then I said, no, they said the heartbeat rate is beating, but today the baby is not moving yet. Then he told me, no, there's no other way they can make your baby to move. What we have to do and we have to check is the heartbeat rate of the baby. Okay. And then he said, no, your pregnant is even small. Since it's 7 weeks, it's 7 months, it's just 28 weeks. So your baby is still growing and still have to develop some of the part in the body. And then I said, okay, doctor, but I'm not used to it. I'm normally used to feel my baby's movement. Wherever I'm eating something, I'm having a snack, I can feel the joy that my baby is feeling good according to what I'm eating. But seriously, I'm very disappointed of this thing. And then on the Tuesday, I tried my level best to walk out of the hospital of this. And then I asked one nurse, and then I said, can you guys allow me to get a paper so I can go and get help from other private doctors outside? The nurse answered me that there is no other way a private doctor will help you since you are COVID-19 positive, so they cannot help you. It might also be a problem to a private doctor that you are also private COVID-19 positive, because sometimes the doctor might also lose job, then you'll be in quarantine because of you. And then I said, now what must I do? If you guys from this department, you are not helping me, since us that are having COVID-19 positive, we are not being helped. The nurse answered again, no, for now I'm trying to clean this machine so I can just go and do the checkup for all people. In the morning, the nurse came in and do the checkup. All of us in the room, then do the checkup with the CPG machine. I was the third person to be done that checkup. And the first 2 ladies, the machine did not take long, only for take 3 minutes, and then the machine was detecting already that the baby is doing fine. And then when he came to me, I was a third person. He was struggling. Apparently, he could not get the heartbeat rate of my baby. Okay. And then he went and get another machine for the blood checkup. He compared it, and the same sound it was given on the machine. It was just the heartbeat of myself, not for the fetus at all. I asked him, nurse, can you feel anything? Then he said, no, the baby is not moving, and I cannot feel any heartbeat rate. I asked him politely, what is next? He told me, no, I have to write a paper to inform the doctor to come and do the checkup. Okay, I let it be. The nurse went for good for the whole day, not seeing him. Later on, around 5 o'clock, is where I saw a doctor with a sonar machine. He came with a sonar machine and do all the checkup. Later on is when the doctor told me, no, the baby is not alive. And then I asked him, you want to say the baby is not alive? What do you mean? He told me the baby is dead. And then I said, oh, seriously. I was very disappointed of these things. And what I'm doing now, I'm very disappointed. And today is Friday. And I was attended on Tuesday when they recognized my baby is not alive, is dead. And today is Friday. And I've been waiting for them to attend me at least to do something. And they are telling me apparently my baby is transverse in the tummy. They cannot do induced labor. So I wait. I must come apparently wait for the social worker to come. And then I told them, what is the work of the social worker? The work of the social worker is just to counsel me so I can try to forget and try to be strong about that emotional. And then the nurse said, yes. But for now, we cannot do anything. We have to wait for the nurse to talk to you first. And then I said, is the time when you guys were doing this? And then on Thursday, on Wednesday, I waited. They are still giving me excuses. On Wednesday, they told me, the blood we took on the other day, Tuesday, it was thrown away regarding the names were not corresponding to the one in the form. Okay, I let them to do me another blood test. And then they were told that they must do it urgent and they must do it on time because this thing is going for many days now. They do it in hurry and then they give the result. Later on they come back to me, they are telling me, everything about your blood is fine. We can do induced labor. A lady among us, the one who were pregnant in the room, he talked to the nurse. Can you guys try to remove this lady from us? Because she is pregnant and now she's no more. So can you just try to remove her out of this room and put her somewhere else where she can be alone? Because it might affect us seeing her the way she is suffering. He said, okay, we will remove her. We waited. They did not do anything for that night. I slept there, suffering all the whole night that I have pain. They bring an injection. They give me injection, Kamais, to let the baby not rotten inside. Because I asked them, what is the medicine for? They told me the medicine is to make the baby not get rotten inside to protect it. Okay. And then Wednesday, it goes. No one attended. They are telling me they are still waiting. On Thursday, they are telling me they are waiting for the doctor coming from Swakop. Later on, I heard, no, the doctor is pregnant, he cannot come. I tried to talk to a lot of different people, and they are telling me they cannot do anything. I asked them a question. Can you guys not just do, are you guys not having a theater in Walvis Bay Hospital? At least you can help me. They said, we have, but you cannot be taken there since you are positive COVID-19. You cannot go there. You might leave infection. And there's another pregnant women that are coming to deliver there. And then I said, oh, should I just suffer like this, carrying my dead unborn child like this? Okay, now you guys, can you transfer me to Windhoek so maybe I can go begin a operation that side? They tell me, no, you cannot go there. We try our best to talk to those people, but they are saying they cannot do it since you are a patient of COVID-19 positive. I understand. and then I let it be. And today is Friday. Until now, I'm in bed laying, waiting for help until today. I'm still waiting for them. And now, right now, it's 7:58 and no one attended me at all. How should I feel if it was someone else? The way we are being treated here in this department, it's like we are not human beings. It's like we are ghosts because everyone is just scared of us. The way they come to us is something else. At least they must try their best. They must change whatever they are doing. It's not good at all.
Well, that was Petrina. Petrina is an anonymous name that we're using, and I am Ester Mbathera in Walvis Bay.